So for the respiratory system, you're going to do a very specific focused exam. You're going to expose the chest, and really by as appropriate just means in private. You want to look at the chest for every patient who's having respiratory distress. So look at the chest shape, look at the symmetry of the chest. Is it look pretty normal? Does it look rounded? You know, if you were look at the patient from the top, their chest is really round compared to their body. Or kind of, barrel shaped out like that. There's your patient's head. Does it kind of look like it sucks in a little bit? Do they have a particular condition on their chest? Do they have any bruising or anything like that? You're also going to evaluate their respiratory effort. You're going to auscultate, which just means listen. So you're going to listen to their breathing. For the cardiovascular system, you're going to check the pulse. You're going to check perfusion. So with this, you're going to look at the skin. And you're going to look at the skin in multiple locations. Is it pale? What about the extremities? The extremities look the same as the chest, the skin on the chest. And you're going to look for peripheral edema. Edema is a fancy word for swelling. If any of you guys have seen somebody who's pregnant or maybe seen an older patient who has really, really big ankles, you've seen swelling. Swelling happens. And so when we talk about peripheral, that means out towards the hands, especially the feet. So look in the ankles. That's the best place to look for peripheral edema. For the neurological system, we're going to check mental status. So we're going to ask them a few questions. How many dimes in a dollar? Who's the president? What's the day of the week? What year is it? And, kind of get a sense of how with it are they. Can they answer all my questions, or are they a little slow? What's going on? We're going to look at their facial expression. If I ask them to smile, does it look like a normal smile? Or is one side, kind of drooped or just flat? So you get this, but, on this side, obviously, it's kind of flat there. And then what's their appearance? Listen to their speech and their language. Is this something, are they garbling their words? I don't actually know how to spell garbling. Garbling, I guess that's right. Is their language, is their speech slurred? Are they using appropriate words? One of the reasons we look at this is to evaluate for stroke. My grandfather had a stroke while he was in surgery, actually, and when he woke up, one of the things he did was ask for a glass of air, not water. He was trying to say he wanted water, but the stroke that he had affected his speech center. So he asked for a glass of air. And it's not uncommon to hear that type of misplaced words, swapping cat for dog, or, like I said, air for water. Those types of swaps are not uncommon. In patients who are having strokes, they're unheard of in patients who are, normally functioning. But patients who have strokes, that's something that happens. And then check their mood. So what is their mood like? Is their mood normal? The other thing with the neurological system that's not really talked about here is kind of the sensation. Can they feel everything? Can they move everything, like all of their extremities? Can they wiggle all their toes? Can they move their toes up and down? Can they reach out and touch you? Can they follow commands? Oops, oh no. All right, little snafu there. So can they follow commands? And you want to make sure that the neurological system is intact. So ask them all those questions, check their face, check their ability to move their extremities, listen to them talk to you, evaluate their mood, and then see if they can follow commands. For the musculoskeletal system, you're going to look for symmetry. So if someone says, my knee is swelling, then compare it to their other knee. Which one's swelling? Does one really look bigger than the other? And what do they feel like? Assess for tenderness. So when you're palpating, does any of this hurt where I'm pushing? Assess for stability. So if you have a patient who you think has a broken bone, you don't want to push too hard, but, is it stable? Is it stable when you palpate all the way down the bone, or do you feel a little bit of movement where there shouldn't be? Range of motion. Can you move your extremities like you normally could? You say your knee is swelling. Are you able to move your knee like you normally would? And ask them to move it around. Do they have sensation? This kind of goes back to neuro, but it's a little bit with musculoskeletal. Can they feel you touching their feet and their hands and their arms and whatever else it is that they're complaining of? Do they have perfusion? So look down in their toes. Do their toes look really pale? Or do they look like they have good color to them? And then check for strength, and check for equality of strength. So if they're saying I'm having trouble lifting my right arm up, then have them try and lift both arms up against your hands, and you can feel, is one side stronger than the other? So in adults, we call it a head to toe. In kids who are a little bit more nervous about things, we usually start at the toes and go to their head. If they're awake and concerned about what you're going to do to them, you can start by, oh, I'm going to tickle your toes. Oh, look, your toes wiggled. And you can see them react and try and interact with them a little bit more comfortably, because kids just get nervous when you have a scary person in a uniform coming up to touch them. So that's normal for kids to do that, and that's why we use the toe-to-head approach in kids. So how do we assess the head? Well, you're going to look at the scalp, you're going to palpate around it and feel it, and look at your gloves and see if there's any bleeding. You're going to, as you're kind of palpating the scalp, you're also palpating the skull. The skull should be a big, hard surface, and if you feel any spots that are squishy, then that's really bad. That's called a skull fracture. You're going to look at the face, palpate the face, look and see if it's symmetric, see if there's any bruising or anything like that. You're going to look at the eyes, check the pupils, look in the ears, see if there's any fluid coming out or any injuries. You're going to look in the nose. You're going to see if there's any swelling or any fluids coming out. And you're going to look in the mouth and the pharynx, so have them stick their tongue out and look and see if you see anything in there that shouldn't be. For the neck, you're going to assess the trachea. So the trachea is your windpipe, and if you touch your neck right in the middle, you can feel it coming down. And just to the right and the left of the trachea are the jugular veins. And so you're going to assess for jugular vein distension, or JVD. I'll write that out. Jugular vein distension. And if something is distended, this is a medical word you need to know. Something is distended, it is basically swollen more than it should be. So it's full. Your stomach can be distended when it's overly full. Imagine if you ate 10 whole pizzas all to yourself, or those hot dog eaters who eat 80 hot dogs in 10 minutes or something like that. When they're done, their stomach is distended because it's so full. Well, your veins can be distended. If you take and hold your hand down by your side and then kind of squeeze the top of your arm, you can make your veins distend in your hand. So do that. Hang your arm down by your side and squeeze your arm. Squeeze it just a little, squeeze your hand, make a fist. And you can look down at your hand now, and maybe you can actually see your veins sticking out. That's called distension. This can happen in the veins in your neck, and it can be indicative of some very serious conditions. Normally, the veins in your neck are flat. But when you have particular conditions, they can actually distend out. So if you look at a patient's neck and you see their jugular veins sticking out, then they have jugular vein distension, or JVD. So be very familiar with this concept of JVD. It's going to come back. You want to assess the neck for any masses. So whenever you go to the doctor will feel in your neck for your lymph nodes, and you can kind of gently feel. And if you feel any large masses, that's going to be a concern. In the back of the neck on the spine, as it comes through your neck, you're going to feel for what are called step-offs. And that is actually going to feel, so you have your neck, and you basically have normal vertebra that are kind of like, oops, things deleting my drawings here. Normal vertebra that all line up. Okay, those don't really line up. But a step-off is going to be basically where you have a vertebra that is really out of place. And it could be because of a fracture. It could be of something else. A step-off is a pretty significant finding. So you're going to feel for step-offs as you feel down their neck. And then look and feel for symmetry. Make sure everything in your neck really should be very symmetric. So if it's not, then that's something that is concerning.